I'm Bill Montgomery, and I'm the Chief Information Officer for Hospital Sisters Health System. It's a Catholic health system, medium-sized. We're 13 hospitals over 2 states in Illinois and Wisconsin. It's about a $2 billion system, and complicated because it covers all different kinds of regions, different types of hospitals, from little to large academic hospitals. So it's kind of a varied, complicated, stretched over 2-state system. Well, as everybody was going through a meaningful use stage 2 preparation, we had to do CPOE and get the doctors using the system in ways like documentation, the order entry, discharge planning, and all those work processes were all new to physicians. So somebody had to support them all hours of the day, weekends, and we just don't have a staff for that. And it's a concentrated time. You're talking about implementing a 2-month time period, anywhere from intense 2 weeks up to 2 months, where they need support. So we needed a group that could come in with a knowledge of how to use the systems, an understanding how to work with physicians, and do it just for 3, 4, 5, 6 weeks. So the solutions that we engaged ESD for were to really support our physicians in the go-live of our Meditech system for CPOE, physician documentation, and discharge process. We needed at-the-elbow support for up to almost 2 months in 10 different hospitals. Well, the solutions from ESD helped solve our problems by giving us the staff we didn't have to do the extra time. You've got all different shifts. You've got 3 shifts a day, 7 days a week. We don't have enough staff to cover physicians who could be there at any moment, early in the morning at 5 in the morning, 2 in the morning, 10 at night, Saturdays, Fridays, Sunday, and so they were really supporting our current staff that did that kind of work. So how ESD really provided a service that was good for us, I think came in really maybe 2 or 3 categories. One is in the planning and the oversight of the whole project. Very good executives that could kind of manage. This is a difficult process. You're talking about bringing people into a hospital for 3 weeks at a time, 5 weeks at a time. They're staying at hotels. They're leaving there and going to another hospital, support that for another go live. We went live with a new hospital every month. So the planning and the scheduling of that was complicated, and to get the resources there, you had to hire them and bring them in and get them trained, and they did a very good job of that planning. Once we had them there, they turned out to be very good people. So they were well trained, and kind of the word on the floor was, you know, we're glad we have those people in the colored shirts. You know, they had these colored shirts that they knew who they were, so the doctors and the nurses knew who to go to, and they felt supported. Well, we put out an RFI to a bunch of groups that do this, but I think what it comes down to is the references we had with other organizations. ESD really had a good reputation to getting quality people there to do the kind of product we had, which was Meditech. So I think the quality customer references is what really drove us there. And we'd highly recommend ESD. They did an excellent job in both managing the project and getting people there that could do a great job.